Good evening, everybody. Thank you very much for joining me in my talk today. Actually, I am Dr. Ahmed Abdelhamid. I am a specialist in internal medicine at Medcare Women and Children Hospital. Our talk today, it will be about management of diabetes. But initially, I would be happy to let you to understand what is diabetes. To understand the problem that we face and the scope of the healthcare problem about diabetes, I would like you to be aware about that we do have approximately 500 million of diabetic population nowadays, and unfortunately with all of our effort this number is in increase day by day. Diabetes in general is a kind of metabolic disorder in which the blood sugar will start rising up, and that might give a symptom and at the end major complication. To understand the diabetes better, we have to know what type of diabetes we do have. In fact, we do have three major types of diabetes. I think most of you, they are aware about type 1 and type 2. So type 1, which is common at young age and in children, in fact. And in fact, this one, it's not representing really the major part, because type 2 actually is almost 90% of diabetic persons, and type 1 maybe it's around 5% of the total diabetics. We have a poor understanding about type 1, and up till now we are not sure 100% why type 1 does happen, why some people are more susceptible to type 1, why the children they might get it at young age. But the most acceptable scenario in type 1 is a kind of autoimmune disease, which I'm sure that most of you they are aware about nowadays, because so many autoimmune disease and disorders are there. So in type 1 we have a kind of antibody which is created by our own body that attacks the cells which is responsible for the secretion of insulin in the pancreas. Leading to complete destruction of this cell, and by the end the patient will have complete deficiency of the insulin hormone. Unlike type 2, type 2 actually so many factors that play in. So we do have, for example, genetic factor, and we are all aware that, for example, if I do have my father or my mother diabetic, so we might have a chance of developing diabetes. And to understand better this one, the importance of the genetic factor in type 2. So if I do have one of my parents diabetic, I might be having a chance of almost 10% to be diabetic. If I have both parents diabetic, I might have this chance increased to 50%. But it's not the only factor. I do have so many other environmental factors that play in type 2 as well. So for example, obesity, which is the main driving factor, and it's the major factor representing the development of type 2 diabetes. I do have stress exposure, and we do have a lot of such kind of factor in our life nowadays. I do have some bad habits like smoking, which might result in acceleration the development of diabetes. Sedentary life and the lack of physical activity also is a big factor which might lead to such kind of development of type 2 diabetes. So in fact, type 2 diabetes is a combination of genetic and environmental factor, which I do believe that part of that we can control, and that might help in the management of diabetes. I would like to go through the third type of diabetes, or the commonest third type, which is gestational diabetes. It's a kind of diabetes which does happen during pregnancy in a patient who was not detected before with diabetes, and it's a special kind of diabetes which have its own special way of management. I will not go in details because we don't have really enough time for that, but I will be happy to speak about the symptom of diabetes now. What can drag your attention that you might have diabetes? In fact, the first symptom of diabetes is no symptom. And most of diabetic people, they might be detected with screen test, which we can hold nowadays in so many places. Actually, so many campaign for diabetes it's everywhere nowadays. At work, you might have one. In the hospital, when you visit one of your relatives, you might have one. And we do have a specific criteria for people who are not having a real symptom for diabetes and how we can diagnose them with diabetes. So the first symptom is no symptom. The second one, I would assume vague symptom or non-specific. Some people, they might come to my clinic telling me I'm feeling fatigue, I feel irritable, I am more nervous. Some, they might come complaining of that their wound is not healing fast, or they might get a frequent infection, regardless where, chest infection, urinary tract infection. So that all might attract my attention toward the diabetes suspicion. However, the classic symptom of diabetes, I'm sure that most of us, we are aware about. So we do have, for example, increased hunger, increased thirst, increased frequency of urination, and progressive weight loss, which is unexplained or a non-intentional one. When we do have such kind of classic symptom of diabetes, so definitely we have to do some kind of test to confirm the presence or to rule out the presence of diabetes. Again, one of the worst scenario that the patient might be detected with diabetes when he develop complication, and that will take us to the complication of diabetes. I do have so many complications, in fact. So part of this complication, it might be acute complication, which is happening so fast, and it might even develop in few days. The commonest of that is hypoglycemia. So some, they might be diagnosed with high blood sugar when they develop low blood sugar. And part of that, which is very common in children and type 1, which is something we call diabetic ketoacidosis, which is very high or very rise of the blood sugar in the blood, leading to some kind of complication, and it might affect the hydration state of the body, and definitely the blood pressure, respiration, and so many other elements and factors. But my concern, and I would like all the diabetic people to be aware about, is not the acute complication, because acute complication actually is bad enough to push the patient to go to the hospital and to be managed. But in fact, it's a chronic complication which might develop over years without the patient being aware about, and at the end, it might lead to a catastrophic scenario. So diabetes might affect every part of our body. We do have, for example, the eye complication. So retinopathy can develop. We do have high pressure of the eye, which we call it glaucoma. We have ossification of the lens of the eye, we call it cataract. This is a kind of common complication of diabetes. We do have nephropathy, which is the damage of the kidney. Actually, the filtering system of the kidney itself, it might be damaged because of diabetes. And by the end, the patient might go to chronic renal failure, and the dialysis might be the only option for diabetic people in such kind of a stage. We do have what we call the cardiovascular complication, which is one of the major complications of diabetes. So we do have myocardial infarction, we do have a stroke, we do have peripheral vascular disease, so leg ischemia. So we can assume that diabetes is one of the major drive and the major disease responsible for amputation of the leg because of its complication. So when we talk about complication, we have so many, in fact, and the only way to avoid such kind of complication to develop is to take care of our diabetes and try to manage diabetes in proper way. I would like to just highlight how we screen diabetes, because it's better always to diagnose diabetes at early stage. And I would assume that most of the people, they are diagnosed with diabetes, they are already diabetic few years even before that. But they are not asymptomatic and they are not screening themselves, so that's why they might detect the diabetes at later stage. So we assume that anybody with overweight, so overweight is a kind of body mass index of 26 and above, and he has any of a risk factors or any risk factor of development of diabetes, like family history of diabetes, like past history of gestational diabetes, so they should be screened for diabetes. In fact, the pregnant woman who developed gestational diabetes, they should go for screening for diabetes every 3 years. This is very important. People, they are receiving a medicine which might affect the blood glucose and it might develop diabetes. They should have their blood sugar screened. I might have a certain high-risk group. I'm expecting them to develop diabetes in the future. They should be informed about that and should be screened for diabetes. Now, because of the lack of time, I will go through the management of diabetes. Actually, diabetes management, first of all, it goes through a lifestyle change. And there is no management of diabetes without trying to change our lifestyle. So I do have so many changes we can do, and it can really control our blood sugar, even sometimes better than the medicine itself. So if we talk about the risk factors which we do have and we can correct, so obesity will come as number one. It's always recommended that we can reduce our body weight by 5 to 10%, which really impacting positively on our blood sugar control. How we can do that? Definitely diet control and exercise are the way. So exercise, in fact, for diabetes, we do recommend 30 minutes of walk or aerobic exercise a day, which is not necessary to be continuous. I might have some patients who will walk for 30 minutes continuously. Some patients, they might have it like 10 minutes 3 times a day or 15 minutes twice a day. But at least we require 30 minutes of walk activity throughout the day. Diet is a very important part. In fact, always we instruct the diabetic people to go to low sugar diet or low caloric diet and low fat diet as well. We need to add more vegetable, fruits, whole grain in our diet, which is really helping in achieving a better control with or without the medication. In fact, not all diabetic people, they require medication. I do have so many stages of diabetes which can be managed just by lifestyle change, and I do have so many people, they are very successful in doing that. Medication, we do have so many, and I think if we need to talk about that, we have to stay like few days. But what I would highlight, something which is very fashionable nowadays, which is bariatric surgery or weight reduction surgery in the management of diabetes. Actually, before, we would assume that bariatric surgery is a kind of cosmetic surgery, but when we saw the effect of such kind of surgery in controlling diabetes in morbidly obese patients, we started actually recommending that. So any patient with body mass index more than 35 might be a good candidate for such kind of surgery. However, such kind of surgery, because it's recently introduced, we are not really 100% sure about its long-term effect. But as immediate result and fast effect, we do have really significant improvement. So for whom the diet control alone is not able to control their body weight and the patient cannot really go for a physical activity because of some problem, like knee problem, and we do recommend such kind of surgery, in fact. So many people, they do ask me about, shall I do implant of pancreas, which is a kind of surgical treatment for correction of or treatment of diabetes. In fact, still this option is not really existing for all patients, because in fact when you do implant or transplantation of the cell of the pancreas, you need to receive a lot of medication which is immunosuppressant, which can decrease your immune response, and that's why such kind of option is just existing when I do a transplant other organ like the kidney. Now I'm going to introduce my colleague Kimia. We will try, both of us, to answer some of your questions. So please welcome Kimia.
Thank you, Doctor, for being with us today for this live session about diabetes. I believe it is one of the very common things that we have nowadays. It's a very common concern. Few of the questions that we've been receiving online are, does diabetes mean that I have higher risk for other medical conditions?
Okay, so I think we have spoken about the complication of diabetes, and we have spoken about cardiovascular risk. Actually, this is one of the most important factor or complication of diabetes. I might get diabetes, which is increasing my chance to have a stroke or heart attack, for example, and that's why nowadays the FDA, which is the organization responsible for giving the license for the medication, is not approving any kind of medication unless it has a protective effect on the heart for diabetic people. We do have definitely the risk of kidney affection, so we can say that hypertension and diabetes are the main responsible causes for chronic kidney disease or end-stage renal failure. So if you go to dialysis unit, for example, you'll find most of the people doing the dialysis there are either diabetic or hypertensive or both. Okay. Eye complication is another one we talk about. Food problem, and we talked about even amputation risk because of neuropathy and vascular affection of the lower limb. So I do have actually so many complications of diabetes and so many other diseases which might really happen because of that.
Okay. The other one, type 1, type 2, type 3. You mentioned there were 3 types of diabetes.
Yeah.
Are the symptoms the same for all 3?
Okay, so it's a good question because actually type 1, because it's happening in children age and younger age, so sometimes it's really very difficult to be diagnosed. I don't have the child able to express the symptom, and sometimes really because he cannot control the urine, so it's very difficult to see the frequency. So, and most of the time, type 1 comes usually with the complication directly. So, most of the type 1 is diagnosed because of diabetic ketoacidosis, which is very high blood sugar. However, in type 2, no. We do screen, so we can detect it. They come usually with vague symptom. So, diabetes screen is a routine screen for anybody coming complaining of fatigue, body pain, irritability. So they might be detected even at early stage because of such kind of vague symptom, and definitely classic symptom because of the environmental and because of most of the people aware about. So usually the patient himself comes to me and asks me to screen diabetes when he has such kind of classic symptom.
Okay. Are there any medications that you can suggest that can help diabetes in the initial stage, or is it necessary for them to come in for a consultation?
Okay, there's nothing called the medicine for diabetes without doctor consultation. Okay, when we deal with diabetes medication, we deal also with so many side effects of this medication. Okay. This medication can control the blood sugar, but at the same time it might take the patient to a complication called hypoglycemia, for example. So that's why always when we talk about diabetes treatment, it should be through a specialist clinic. Okay. And in fact the medication is not uniform, and the medicine should be used individually, or it should be tailored upon the patient condition, and so many other factors that play in that. That's why management of diabetes is a doctor management. It cannot be a patient management.
Okay. One other thing, you mentioned about bariatric surgery and some of the surgeries that you mentioned. Is it safe for the diabetic patients to undergo this even if their numbers are high? Okay, so
not to let somebody to understand my talk wrongly, not all the patients are candidate for bariatric surgery. Okay. Actually, bariatric surgery has been designed for morbidly obese patients when they are not able to lose weight, or they have tried even to lose weight and this is not successful. So at the time, actually bariatric surgery might be a very good solution for them, because actually obesity is not just responsible for diabetes. It might be responsible for diabetes, it might be responsible for ischemic heart disease, it might be responsible for hypertension, hyperlipidemia. So I do have so many medical conditions which might develop because of obesity. That's why if I do have diabetes, which is not really well controlled, and the patient is obese and all the lifestyle changes has failed in managing his condition, so this is the time that we can say this patient might get benefit from the bariatric surgery or weight reduction surgery. However, still the study about the bariatric surgery is not 100% complete because we're still waiting the long-term effects of this surgery.
Okay.
And hopefully we will not find really something against.
Okay. The other question was, you mentioned about how diabetes affects the different parts of the body. How often should a patient go for the specialist consultations to check, for example, the eye or the foot? How often should that be visited?
Okay, again, this is something that we cannot say it's a fixed timing, because I do have some patients who will go for screen. Actually, annual screen we always recommend in different way. Sometimes I can screen the kidney by doing a urine test. Sometimes I do the screen the eye by ophthalmologist visit, by fundus examination, estimation of the pressure of the eye. But if I detect something abnormal, so definitely this patient needs to be monitored more often and he needs to visit the doctor more often. It's based on what kind of condition I have detected and how bad is it. Okay? So that's why annual screen is always recommended for other specialty like nephrologist, ophthalmologist. But still, if we have something wrong and such kind of screen, so the patient should be monitored more frequent.
Okay. And one last question. There have been cases where people type 1 diabetes or type 2 diabetes have gone into insulin and it's reversed back. Is that true? Can insulin be reversible if a type 2 patient has gradually moved into an insulin dependent?
You mean they need to stop insulin after
Yes.
they started insulin? In fact, insulin can be used in both type 1 and type 2. Okay. So I might use the insulin based on my own personal judgment, and after that the patient will start doing some kind of significant lifestyle change, so he will not be in need to have the insulin anymore. If we talk about the treatment, we talk about so many factors that play in glycemic control. Okay. So for example, if the patient is obese and he started losing weight, so definitely he might get rid of half of his medication, including the insulin. Okay. If this patient was not doing any kind of physical activity before and he started doing, so definitely that might improve his blood sugar control, and that might give us a chance to decrease or wean off part of his medicine. Okay. So some people, they might get the insulin and go back to oral treatment, and some they might get insulin and oral treatment, and after that they will be just on diet change. Okay. Or diet regimen, and the blood sugar will be still controlled.
So it can be reversible?
It can be, definitely, but it's not really a rule, and it's something subjective to so many other factors related to the patient lifestyle itself. Okay. Okay.
Okay. Thank you, doctor, for joining us.
Thank you very much.
That's about it from our viewers at the moment. Thank you so much.
Thank you very much.
Thank you so much.
Thank you. Thank you very much, everybody. I'm very happy today for such kind of presentation, and I will be happy to receive any kind of further questions or to see you even in the clinic. Thank you very much and have a nice evening.